for this question, once again, we're going to go through the 7 steps we have. So we're going to start by just covering up the answer choices, and we've already done that, so great. Now we're going to move to step 2, which is kind of read the last sentence or the question itself. And for this one, it says, which of the following would be which of the following would most likely be seen on kidney biopsy? So which of the following would be most likely seen on kidney biopsy? So they want to know a biopsy result. So now moving into step 3, how many steps do we think this would take to answer this question? Well, this would be a 2-step question. So first we're going to have to come up with a diagnosis, and then we're going to have to think in that diagnosis, what would we see on a biopsy? So that'd be 2 steps. So 2 steps to answer this question. Now let's read that question kind of from the top, 1 sentence at a time, trying to think of anything that could clinically correlate to our answer, our question that they're asking us down there. So here we have a mother that brings in her 8-year-old son to the pediatrician. Reports that for the last 4 days he has been complaining of some tummy pain that comes and goes. So we have a little 8-year-old boy that's got a 4-day history of some belly pain that's kind of maybe waxing and waning. The boy's also been complaining of pain in his legs, and he refuses to play with other kids at school. That would be kind of a red flag for a young kid. The lack of desire to play would be weird. You wouldn't expect that. So the boy is febrile and has a temperature of 101.2 degrees Fahrenheit or 38.4 degrees Celsius. On physical exam, he appears flushed and has a palpable maculopapular lesions on his legs and buttocks. That's a big one there. Something to highlight, something to kind of point out. That's a fairly narrow differential when you start getting maculopapular lesions on lower extremities in young kids. You can see it in adults. You can see it in kind of a few different scenarios, but that's definitely one to kind of just memorize the 5 or 6 or 7 things that can kind of do that. So anytime you see those words, maculopapular lesions, on an exam, you can go, hey, it's probably going to be one of these things. So the boy cringes as the pediatrician palpates his abdomen. Laboratory tests show a sodium of 139, a potassium of 4, chloride of 100, bicarb 24, BUN 30, creatinine 2.3, and his C3 level is normal. So kind of some important stuff to point out there is, this 8-year-old kid's got some definite signs of kidney injury, something you really wouldn't expect in an 8-year-old. He's not, 80 with a bunch of chronic comorbidities. So that's a little odd there. Something else to point out is the normal C3 level. They're giving you that information for a reason. Once again, the questions are written with a goal in mind. So just remember that when you see something, even normal levels of complement. Usually don't include complement data in questions unless it's something you really want to know. So now kind of moving on, urine dipstick reveals brown urine, no glucose, and some 2+ protein. And now kind of reading that last sentence again. This would be our next step. So I think we're on to step 5, which is which of the following would be the most likely seen on this biopsy. So now we're kind of thinking about the question that we just read, and now we want to kind of generate our differential diagnosis. So what do we think we're going to see as our possible answer choices kind of moving forward? All right, now that you had a little bit of time to think about it, let's uncover our answer choices. All right, great. And now we're going to move through these starting from the bottom up, which is going to be our step 7. So first up, we have E, which is a mesangial IgA deposition. Then we have E, which is linear immunofluorescence on electron microscopy. Then we have C, which is foot process effacement on electron microscopy. Then we have B, which is starry sky pattern on immunofluorescence. And then we have A, which is spike and dome appearance on electron microscopy. All right, so those are our answer choices, and I'll give you just a little bit more time to think about it, and we'll post or put up a poll and let you vote here.
All right, I'm going to open up a poll here in just a second. Then you guys can put in your answer choices. So go ahead and lock on one, and then once I pop this up, go ahead and submit that answer. So here we go. Poll is now open. Go ahead and put in an answer. All right, looks like we've got about 15% of the folks have voted. So go ahead and lock something in. And remember, on the USMLE, there's no penalty for guessing, as you might have seen on other exams. So there's no reason to leave any of the questions blank. All right, looks like about 40% of you guys have answered. All right, looks like it's coming in pretty quickly. About 2/3 have answered. So I'm about to close the poll in a couple of seconds. Just wait for a couple more votes to straggle in. All right, great. Close to 3/4 of you folks have answered. So let me go ahead and lock the poll down, and I'm going to share the results. And what you see here is that roughly half of you folks chose E, mesangial IgA deposition, and then the second most popular answer was foot process effacement on EM. All right, so let's actually look at the actual answer, which is E, mesangial IgA deposition. So good job. All right, back to you,
right.
back to Dan.
Yeah. And if we could just bring up the question on the, I think it's the following slide.
Oh, wait a minute. I think I need to get rid of the poll here. Give me a second here.
All right, great. So mesangial IgA deposition, that's the correct answer, and most of us got it right, so good job. So kind of going through our answer choices again, we'll start at the bottom and work our way up. So what is this question talking about? Well, this is, we've got our young kid, he's complaining of, he's presenting with some kidney injury, as well as some abdominal pain, some arthralgias, this kind of general, maculopapular rash on his legs and buttocks. This is pretty classic for HSP or Hennig-Schalen purpura, which is an IgA vasculitis, and it's commonly seen in young kids. It usually presents with maybe some fever, malaise, kind of to start with. They get some abdominal pain, progresses to some proteinuria. You can also see some hematuria, and then you also get kidney injury, significant kidney injury. So, and that's kind of what we're talking about here. So that's this question. If you were to look under immunohistochemistry, you would see the mesangial IgA deposition. And this is classically considered a type 3 hypersensitivity reaction. So that's kind of the stuff you need to know a little bit here. And all of these are kind of good words or good phrases to remember when you're asked questions about kind of your renal stuff. The spike in dome or the starry sky or foot process effacement. Just kind of things that you almost just need to commit to memory to get these questions right, at least for step one. For step two, that they give you a little bit more clinical information that may be able to weigh you one way or the other. So now moving on to answer D. So once again, E is the correct answer with mesangial IgA deposition, and the disease state is Hennig-Schalen purpura. So our two-step question was, you need to know this was HSP. After you knew it was HSP, you needed to know what you would see on the biopsy. And what we would see on the biopsy is the mesangial IgA deposition. For the linear immunofluorescence on electron microscopy, this is Goodpasture syndrome. Once again, the antibodies bind directly to the basement membrane here, kind of causing a linear pattern. And you can see this on biopsy of the lungs as well as the kidneys. You also get complement activation, so you can actually see lower complement levels. We had a normal complement level here. For answer choice C, foot process effacement seen on EM. This is minimal change disease. This is one of those things, is the child is kind of in that right age range, 2 to 8 years old. Usually this is more of a nephrotic syndrome, so they might talk about, that 3.5 grams of proteinuria. They also might describe, some lower extremity swelling or facial swelling, which is basically just edema from, loss of, protein, just kind of lose their oncotic pressure there. Once again, so the loss of foot effacement or foot process effacement on electron microscopy is minimal change disease. Just also for minimal change disease, something to note, if they say that they got a biopsy of the kidney and looked at it on light microscopy, so not electron, but just light microscopy, it would look normal. So it's a normal biopsy on light microscopy. It's only until you get into the electron microscopy, which looks at things under a much higher magnification, that you see the foot process effacement. Moving on to B, we have the starry sky pattern on immunofluorescence. This is pretty consistent, or most consistent, or classic for our acute post-streptococcal glomerulonephritis. And they'd like to compare, the IgA nephropathy or the Hennig-Schalen purpura and the acute post-streptococcal glomerulonephritis. They like to link those two together. So if you see one of those answer choices, usually the other answer choice is also going to be there. And the reason they like to do that is the post-streptococcal glomerulonephritis causes low complement levels, while IgA nephropathy or Hennix-Schönlein purpura causes normal complement levels. So that's one kind of a compare and contrast I'd like to do there. For the post-streptococcal glomerulonephritis, this usually presents 10 to 14 days or 10 days to 2 weeks, kind of after a group A beta hemolytic strep infection. So that's kind of what you're looking for. Here we're going to see the subepithelial deposits of IgG and the decreased complement like we already talked about. So just kind of remember those key facts for the post-streptococcal glomerulonephritis. And then moving on to our last one, our spike and dome appearance on electron microscopy. Once again, this is consistent with membranous glomerulonephritis. So if you think of membranous glomerulonephritis, think of the spike and dome appearance. And this is again a nephrotic syndrome seen in adults. So a nephrotic syndrome seen in adults, so not in kids. That's why this one would be wrong.